everybody, I am Savan and we'll continue our discussion on the autonomic pharmacology. So today we are going to study about the cholinergic drugs. The cholinergic drugs क्या हैं? Cholinergic drugs are group of drugs that are basically affecting the cholinergic system. Yes, दो तरह की cholinergic drugs हैं. First of all, direct acting and the indirect acting. Here we'll mainly first focus on the action of the direct cholinergic drugs. Direct cholinergic drugs का मतलब है that the drug should bind with the cholinergic receptor. What is the cholinergic receptor? It can be muscarinic or the nicotinic receptors. I have told you, yeah. So the drug should bind with the cholinergic receptor and it should produce the cholinergic effects. Yes. For example, I want to constrict my pupils. We know that pupillar constriction is function of cholinergic system. So I can administer a drug that can bind to its receptors that are present on the pupil, that is muscarinic receptors जो कि pupil पर present है, and वो cholinergic जो drug है, जो direct acting है, it will bind to the M3 receptor on the pupil, yes, and it will produce the parasympathetic effect. What is the effect? Constriction of the pupil, yes. So similarly, cholinergic drugs जो हम देंगे, that is according to what effect do you want to produce. Okay, for example, if I want to produce a parasympathetic effect of pupillar constriction, I'll give some other drug that is targeting the receptor that is only present in the pupil, that is M3 muscarinic receptors. And अगर मुझे for example heart beat को कम करना है, तो I will give another cholinergic drug that is targeting the M2 receptors that are only present in the heart. So drug का action basically depend करता है on what type of receptor it is acting. If it is acting, group is cholinergic drug, yes, but if the drug is acting on M3 receptors, so it will produce pupillar constriction. If it is acting on M2 receptor, it will produce bradycardia or decreased heart rate. ठीक है, तो अभी हम cholinergic drugs की यूज के बारे में हम बाद में डिस्कस करेंगे, बट फॉर नाउ वी आर गोइंग टू डिस्कस हाउ इज द acetylcholine produced. So let us recapitulate. From the spinal cord we have what nuclei of the nerves, yes, 3, 7, 9, 10 that are associated with the parasympathetic supply. So preganglionic neuron and the postganglionic neuron and the effector, it is how the parasympathetic system is made. Yeah, so let us take the example. This is a neuron, a cell body is not made here. This is the axon of the neuron, axon. And what is this? This is the presynaptic membrane. Presynaptic membrane means वो membrane जो कि synapse के पहले है, because this is what synaptic cleft, this area, and this is what presynaptic membrane. ठीक है. And what is this? This is the cell body of a postsynaptic neuron. ठीक है, इसके ऊपर this postsynaptic neuron cell body should have what? Receptors. Receptor for what? Acetylcholine. Acetylcholine will be released by which neuron? It will be released by the presynaptic neuron in the cleft, and from the cleft this acetylcholine will bind to the receptor. So it can be, it can be postsynaptic receptor also having the muscarinic receptor, postsynaptic neuron having the muscarinic receptor, or it can also be your skeletal muscles, because skeletal muscle भी हम जानते हैं, it is also the contraction of the skeletal muscle is mediated by the somatic neurons, and जो somatic neurons हैं वो भी acetylcholine secrete करते हैं on the receptors present in the skeletal muscle, that is NM type of nicotinic receptors. Okay, तो वो छोड़िए आप, and will come with how the acetylcholine is synthesized. So this is a neuron, ठीक है, and this neuron have to synthesize acetylcholine. This is presynaptic neuron. It should have acetylcholine, then only it will be able to release it. ठीक है, तो how it is made? So here is a very special type of, you can say, transporter on the membrane of the neuron that is called as sodium choline co-transporter. What does it do? It transports the choline that is okay, the choline that is present in the extracellular space, and from the extracellular space it takes up the choline and brings in this space that is within the neuron, the axon of the neuron. Okay, the last part of the axon. Okay, after the choline is here, choline combines with the acetyl-CoA already present. Acetyl-CoA कहाँ से आया? We know the acetyl-CoA is produced in the Krebs cycle. Okay, so from there we have the product acetyl-CoA in the neuron. So this acetyl-CoA is going to combine with the choline that we got from here, and this acetyl-CoA plus choline is going to give what? Acetylcholine. Very simple. So is there any enzyme involved here? Yes, there is one enzyme that catalyzes this reaction. This enzyme is called as choline acetyl transferase. मतलब कि choline को वो acetyl group में transfer कर रहा है वो वाला enzyme. So this enzyme is called as choline acetyl transferase. It is written like this. Okay, now we have formed acetylcholine. Okay, as soon as we form acetylcholine, it should get transported in these vesicles. These vesicles are empty initially, but when we form acetylcholine, this acetylcholine is transferred in these vesicles. I have shown the vesicles having the blue colored acetylcholine within them. So this is the second step in the synthesis of acetylcholine. Why it should be transferred? Because agar acetylcholine is here and it is not transferred, this acetylcholine is sensitive molecule, and we have the enzymes in this space that can degrade the acetylcholine. So we don't want acetylcholine to be naked or to be exposed to very destructive enzymes that are present here. Okay, so the better is that we transfer this acetylcholine in these vesicles. Okay, this is the second step. Okay, these steps have significance. Okay, what significance? That there is a substance that is called as hemichollium. What is the significance? This hemichollium blocks this transporter, and if it blocks this transporter, the choline cannot be transferred here and the acetylcholine will not be synthesized. So this suppresses the synthesis of acetylcholine, and thus the parasympathetic outflow can be lowered because of this drug. Then we have another drug that is called as vesamicol. Vesamicol, what does it do? It prevents the uptake of acetylcholine into this vesicle. So it doesn't let the acetylcholine to be transported in the vesicle. Same effect will be produced, that is low level of acetylcholine in the synaptic cleft further. Okay, then second step tak humne kar liya hai, and what should happen now? These acetylcholine that is there in the vesicles, this should get released into what? This should get released into the synaptic cleft. Vesicle should not get released. Only the acetylcholine should be released into the synaptic cleft. So what happened? The third step is that this vesicle, the membrane, this black membrane of this vesicle get attached to the presynaptic membrane of the neuron. So this is how does it happen. This is the black membrane of vesicle and this is the membrane of the presynaptic neuron. So they will fuse together and the acetylcholine will be released from the synaptic vesicle into the synaptic cleft. ठीक है. So this is the third step. This step should only occur when there is a depolarization current. You understand that we know that neurons are working under the influence of depolarization. So जैसे ही this neuron membrane will be depolarized, ठीक है, this depolarization sensitive calcium channels will open up that are also present in the membrane. Okay, so this calcium channel will open up, and when this calcium goes inside, only when the depolarization has occurred, this calcium will signal these vesicles to go and get fused with the presynaptic membrane. So calcium is very important so that the vesicles are able to release its content in the synaptic cleft. Okay, so do we have any compound that can affect this third step, that is fusion of the vesicle? Yes, very famous botulism toxin that is produced by Clostridium botulinum bacteria. Okay, so this botulinum toxin can prevent this fusion. Again, it will result into no acetylcholine here, and that will further result into what? Paralysis. Why paralysis? Because acetylcholine won't be able to act on what? Skeletal muscles, and skeletal muscle won't contract, and thus it will be paralyzed. That is called as flaccid paralysis. Okay, so the application of botulism, this, and then we have the fourth step, that is the acetylcholine is here, and this acetylcholine that is within the cleft, the acetylcholine within the cleft should bind with its receptor on the postsynaptic neuron, and as soon as it binds with its receptor, it will give signaling effects. Okay, for example, let us assume that this is what, this is a receptor of acetylcholine present on the heart. Okay, for example, this is the myocardium cell. Okay, take example, this is a myocardium cell having M2 type of receptor, and as soon as the acetylcholine will bind to this orange M2 type of receptor present on the myocardium cell, it will give such signals to the heart muscles that these heart muscle will have lower strength of contraction, and it will produce bradycardia. Similarly, if the receptor is on pupil, it will produce pupillar constriction. So different effects will happen depending on where is the receptor present, or on which organ the acetylcholine is acting on. Okay, when the receptor has been stimulated, what happens is that the acetylcholine in the cleft, it gets degraded into two components, that is acetate and the choline. So acetate and the choline, so which enzyme is very important for the degradation of acetylcholine? ACE, this monster enzyme that is already present in the cleft. This enzyme is called as acetylcholinesterases. Esterases mean it will break the bond of ester bond that is present in between the acetate and the choline molecule. Okay, so this is degraded here, and the choline can be reuptaken by this neuron presynaptically, and it will again lead to the formation of acetylcholine. So this whole process is very important. So I would like to ask you that अगर हम इस enzyme को degrade कर देंगे, that is ACE, that is acetylcholinesterases, so what will happen? If this enzyme is degraded, there will be no degradation of acetylcholine, because यही enzyme है जो acetylcholine की degradation करा रहा है. So if you degrade this enzyme, or if you block this enzyme by certain agent, what will happen? There will be unopposed release of acetylcholine and the action, stimulated or more action of the acetylcholine on the receptor. So क्या ऐसे कुछ agents हैं that can do this effect? Yes, there are agents. These agents are physostigmine, pyridostigmine and the androphonium. These three agents, इनको हम indirect cholinomimetics भी बोलते हैं. So here is the indirect cholinomimetics drugs. ये क्या करती हैं? They block these enzyme, and इस enzyme की blockage की वजह से there is increased level of acetylcholine within the cleft, synaptic cleft. So synaptic cleft में ज़्यादा acetylcholine है, मतलब कि the effect is going to be pronounced, it will be more. So you are mimicking the action of acetylcholine, or you are increasing the action of acetylcholine, but this is not directly, this is indirectly, that is by blockage of this ACE enzyme. Okay, so this is how does this process happen. तो अब हम आएंगे डायरेक्ट cholinomimetics drugs के ऊपर. डायरेक्ट cholinomimetics drugs का मतलब ये है कि they will directly bind to the receptor of acetylcholine. Receptor क्या है acetylcholine? It can be anything. It can be nicotinic receptor, it can be muscarinic receptor of any type, M1, M2, M3, M4, M5, and nicotinic receptor N type and NM type. So M1, M2, M3, M4, M5 and N1 and N2, these are nicotinic receptor, and these all are muscarinic receptors. तो ये receptor जो हैं, these are the targets for the acetylcholine molecule. Okay, तो drugs जो कि cholinomimetics है, they should bind with either of these receptor, all of them or some of them. This is what makes a drug selective or the non-selective. Selective drug, for example, ऐसी drug जो सिर्फ M2 receptor पर bind करे. M2 receptor सिर्फ heart पर present है, so it will give effect only on heart, muscarinic receptor of the heart, but it will not bind to any other muscarinic receptor that is present elsewhere in the body. So this means the drug is very selective. नॉन सिलेक्टिव ड्रग का मतलब है नॉन सिलेक्टिव मस्कुलिनिक ड्रग इफ आई से नॉन सिलेक्टिव मस्कुलिनिक ड्रग का मतलब है इट कैन बाइंड टू एनी ऑफ द मस्कुलिनिक रिसेप्टर M1 M2 M3 M4 M5 all of them. It does not have capability to select one out of 5, so that is non selective muscarinic binding drug. Okay, so अब हम कुछ ड्रग्स के बारे में बात करेंगे. फर्स्ट ऑफ ऑल एंड देयर एप्लीकेशन. पाइलोकार्पिन. पाइलोकार्पिन क्या है? So this is the target organ. For example, this is pupil. ठीक है, and here it was what was it? This was postsynaptic neuron, and this is the effector organ. So this, axon of the what we say postsynaptic neuron, it will release acetylcholine here, and this acetylcholine will bind to this pupil, a receptor present on the pupil. ठीक है, this normally happens and this causes the contraction of the pupil. But what we are doing, we are giving such molecule that mimics the effect of acetylcholine. It means that की molecule pilocarpine is not acetylcholine. Acetylcholine नहीं है pilocarpine, but the pilocarpine effects are just same as that are produced by the acetylcholine. So अगर मैं pilocarpine लेता हूँ, you should remember P for pilocarpine and P for pupil. What is the effector tissue of the pilocarpine, where it produces the effect? Mainly on the tissues, or for example pupil. Pupil having the M3 receptor. So if I give you pilocarpine eye drops, it can bind to the M3 receptor on the pupil, and what will be the action? Constriction of the pupil. That is called as meiosis. So if you want to produce a meiosis in patient, we have a drug of choice called as pilocarpine. It can cause the pupillar constriction, but what else it will cause? We know pupillar constriction is what? Narrowing of the pupil, constriction of the pupil. But हमें पता है कि ciliary muscles are also there, and ciliary muscles पर भी M3 receptor present होते हैं. So this pilocarpine will also cause the contraction of the ciliary muscles, and this contraction will cause what? The accommodation of vision for the near objects. So you won't be able to see the far objects, and you will be able to see the nearer objects. So this is how the pilocarpine works. It is used in the angle closure glaucoma. Angle closure glaucoma एक disease है, and it can be treated by producing meiosis. ठीक है, so this is effect of pilocarpine. The second drug जो है हमारे पास, that is bithanicol. Bithanicol also acts on M3 receptor, but we are not putting bithanicol in your eyes. We are giving it by the oral route or some other route, and this bithanicol will mainly bind to M3 receptor present on the bladder. This will cause the constriction of the detrusor muscle in the urinary bladder and will cause the release of the urine. So in patients, some patients में क्या होता है that after surgery the patients are not able to pass urine. So in that case we can give such patients bithanicol to produce urine out of them, to make them micturate. Okay, the other drug we have is methacholine. Methacholine वो drug है that can bind to the myocardium, which receptor? M2 receptor, and will cause decrease heart rate. So this methacholine can be used in the cases of tachycardia or arrhythmias. Similarly, we have carbachol. Carbachol, you should remember, it is not selective, as these drugs were only binding to the muscarinic receptor. This carbachol can bind to the nicotinic receptor also and the muscarinic receptor also, so it will produce the mixed effects. So this drug is not preferred much. ठीक है, इसका कुछ इतना ज़्यादा यूज़ नहीं है, because we want only selective action on some organs to cause treatment of the patient. ठीक है, this carbachol is having multiple effects because of binding to N and the M type of cholinergic receptor. So where can we use it? Only in the cases of glaucoma that is not treated with the pilocarpine in such patients. Okay, और मैं आपको I am giving you a mnemonic here to remember the effects of parasympathetic system, because these drugs, you should know, if the toxicity you are taking them in very high doses, that is toxic doses, it can produce cholinergic crisis. Cholinergic crisis का मतलब है undue overactivation of the cholinergic receptors. ठीक है, तो what is the mnemonic here? Dumbbells. You can remember dumbbells मतलब diarrhea, urination, meiosis, bronchoconstriction, excitation, lacrimation, salivation, and the secreting. This is what happens when your parasympathetic nervous system is overactive. So we will discuss in the further future videos that what are the drugs that can cause the cholinergic crisis, or that can overactivate your parasympathetic nervous system at such an extent that it can be fatal for your patient. Hope you liked the video. Thank you for watching it, and please like and comment and subscribe to the videos. Thank you guys.